anyone who's had any kind of abdominal surgery is at risk for small bowel obstruction for the rest of their life.
Once an instrument enters your abdomen and your pelvis, you are at risk of adhesions. And adhesions, they continue with time. They present over long time, long when you forgot about it. You know, you got your tummy tuck, you went to Bahamas, you got drunk, and you're like, I'm happy. 5, 6, 10, 20, 30 years later, one day you have pain, and voila, you have small bowel obstruction. Every time you're going to fix it, the trauma and trigger causes more.
When I ask people, okay, you've had the surgery, what are you doing to prevent further complications? They just say, I didn't know I had to do anything. That for us was the ethos behind, okay, we're going to at least create this prevention kit so that you're tackling 3 things that disproportionately affect people of color: hormonal imbalance, inflammation, vitamin D deficiency, so that you can at least put yourself ahead of the game with